Great, thanks Penny, and thank you for inviting me to the conference. And I have no conflict of interest other than the research funding I'm going to talk about as I talk. So I've been asked today to talk about the experiences of partners of people with cancer in relation to sexuality. And we've already heard a lot at this conference about sexual health issues and sexual concerns of cancer survivors and of cancer patients. But there's a lot of focus on the person with cancer, probably understandably, because that's the person that the clinician is working with. And there's also been a lot of focus on sexual functioning rather than general sexual health, and also on sexual and reproductive cancers, although I do acknowledge that Deborah in her talk demonstrated that sexuality is affected across a range of cancer types. But a lot of previous research has also used a heteronormative framework, and assuming cisgender, so assuming that patients are heterosexual and using a gender binary of male-female rather than acknowledging the experiences of transgender individuals. So what I want to argue in this paper is what we need to do is also acknowledge the sexual needs and concerns of the partners of people with cancer, and look at the way in which sexuality is experienced and negotiated in the context of relationships for many people. And we need to also look across tumour types, not just look at sexual and reproductive cancers, and to acknowledge sexuality and gender diversity, so to acknowledge the experiences of the LGBTQI population. Now, what I want to do in this talk is I'm going to talk about some research results from a number of studies that I've conducted with my colleague Jeanette Pers, and actually look at what the experience of the partners are across gender and sexual diversity. And I'm just going to start by briefly introducing 3 studies that I'm going to draw on. The first was a large study. We looked at the experience of cancer carers funded by the Australian Research Council. And as part of the broader carer population, we had 156 who were sexual partners of people with cancer who completed a survey, and we also interviewed 20 of those partners, the majority of whom were heterosexual. What we found in this study was that 78% of the partners said that cancer had impacted on their sexual life, on their sexual health. And that was across both reproductive and non-reproductive cancers. And just to illustrate the range of cancer types we had in that study, so they weren't just sexual and reproductive cancers. The second study, again funded by the Australian Research Council, specifically looked at issues of sexual health and sexuality post-cancer, and we looked at the experiences of patients, of partners and healthcare professionals. Again, we had a whole range of cancer types, more breast cancer than other cancer types, partly because it was women with breast cancer who were more likely to take part in the study. But again, we had 193 partners completed a survey, and we also interviewed 39 partners. Again, we found the majority of partners reported that they had sexual changes after cancer, and you can see that's across a whole range of different cancer types, so again, not just sexual and reproductive cancers. When we asked people what form of sexual activity had changed, you can see that sexual intercourse had the biggest change, but also sexual activities changed across a whole range of other types of sexual activity. So it wasn't just coital sex or sexual intercourse. So people also said they were less likely to engage in oral sex, masturbation, kissing, use of sex toys. And we know from other research that when sexual intercourse is not possible because of changes in sexual functioning, other forms of sexual intimacy also are reduced or sometimes stop altogether. And the third study I'm going to draw on is a study I talked about on Friday, which was a comparative study we did of gay and bisexual men with prostate cancer, funded by Prostate Cancer Foundation of Australia. And we interviewed and gave surveys to both gay and bisexual men and their partners, as well as a comparative group of heterosexual men. And what we found is the gay and bisexual men were more likely to report sexual distress, anxiety around cancer, lower masculine self-esteem, and lower quality of life. And all of the men across groups reported changes in sexual well-being. So I'm just going to draw on those 3 studies to actually make a case that what we see in the partners of people with cancer, and we've heard a lot already about the people with cancer themselves, what we see in the partners is an experience of sexual disembodiment. And I'm drawing on a theoretical framework here, which is looking at changes in embodiment post-illness and using this to actually understand changes in sexuality. And how this is described, the experience of disembodiment, is that the body and self are experienced as dysfunctional, ill, and at odds with one's desired presentation of self. So this isn't just about sexuality, if sexuality could ever be a just, because I think it is very important. It's also about how the person sees themselves, their whole identity, and the whole experience of the body. And what I want to argue in this paper is that, yes, that this sexual disembodiment is experienced by people with cancer, and that's something that comes out very strongly from our research, and I think was illustrated in the previous two presentations, but it's also experienced by the partner, and the partner needs to be part of the equation. So you might say, well, why is this so? Why does the partner experience the changes in embodiment, in disembodiment after cancer, after their partner has cancer? Some of this is about what's happening with the patient. So we know that many patients experience lack of desire, loss of desire after cancer. So one of our participants said as a result of the treatment, their libido is reduced. And here's some quotes actually from patients talking about no desire to be sexual, lost the urge to have sex, loss of passion, and my sexuality just stopped. Now, I've drawn these from interviews across our studies, and you can see that's across gender and across sexual identity. This is something that is fairly uniform. This has an impact on the partner, because if you're in a relationship with somebody who has no desire to have sex, well, that has an impact on you. Also, as we've already heard from the previous speakers, particularly from Deborah, many patients experience changes in body image after cancer. And here again, quotes across gender and across sexual identities. One person saying, I feel less like a sexual being and more like a breathing blob. My body is grotesque. I feel unattractive. Change in penis size, particularly having an impact on gay men. And changes in body weight. So again, if you're in a relationship with somebody who feels that they're grotesque, they're unattractive, they're a blob, that's going to have an impact on you and on your ability to be in sexual relationship with that person. Many individuals experience a change in masculinity and femininity, a change to their gender identity after cancer. And you can see this in terms of quotes from patients. So assault to masculinity, don't feel like a full male, or a woman talking about this has impacted on my identity as a woman and a wife. We had a relatively small proportion of lesbian and bisexual women in our research, and none of the lesbian women actually gave accounts such as this, which is interesting. What we find is that this has an impact on, again, on the partner. And many individuals talk about not wanting to initiate any sexual activity or to engage in sex because of being aware of this. And this is particularly the case with heterosexual women. And I've got a quote here from Jenny who talks about, I wouldn't be a good wife to him if I was demanding anything of him. It wouldn't be fair to make him feel worse than he already does. So an awareness of the potential emasculation of the husband here. Sexual pain is a common experience after cancer, as we've already heard, and here are just some quotes, both from men and women, and it's often overlooked that many men experience sexual pain after cancer. So two men here talking about painful to have an orgasm and getting extreme headaches after climax. But what's more commonly known is that many women experience extreme pain, particularly on coital sex after cancer. And as Deborah said, it's surprising that many women still continue to engage in coital sex, and I'd argue that's because of the coital imperative, where sex is seen as intercourse. And Sue here says it feels like he's got razor blades strapped to him when she's having intercourse. And we found that many male partners actually say they avoid having sex or don't engage in sex because they want to avoid pain in their women partners. So I don't want to put that stress on her, but it might not just be about intercourse. It might be awareness of other sorts of pain that could be caused. So Ed talking about, having a sore and sensitive area. So, don't want to suddenly give her a big cuddle. So awareness of that and being in relation with that person actually then having an impact on sexuality. Many partners talk to us about feeling very guilty because they still desired the person with cancer. They still wanted to have sex with them. They still wanted to be intimate. And it was something that was particularly strong for many men who felt that they had to contain those desires and felt very bad about themselves because of it. So Paul talking about, he didn't want to stop acting like an animal because she's a sick woman and he should just get over it. So feeling, that there was something wrong with them, that they still wanted sex even though they were living with somebody who had cancer. And many partners also talked about feeling quite a lot of sexual frustration because they still wanted to be intimate. So Jenny talking about she'd just walk out of the room and get furious because she still wanted it. And Mel talking about why get yourself all stimulated if you can't do anything anyway. Another factor that we found was that particularly in the heterosexual women carers, that many of the women talked about positioning their partner now as a child or as a patient, and that you don't feel desire for somebody who's a patient or is a child. So Sarah talking about, you've lost the relationship you had and it's redefined. So it's like what you'd have with your children. So saying it's quite similar to what it was like when I looked after my children when they were young. And Melanie talking about they're not the person that they were and I don't have any physical attraction towards him whatsoever. And this can be something that can cause quite a lot of discomfort for the partner who can feel that this is something they can feel quite guilty about, that they don't have that desire. Also, many partners talked about their own tiredness, their own worry, their own anxiety. And we know in other research and previous research we've done showing higher rates of anxiety, distress in cancer carers than in people with cancer. And that was something we found in our broader cancer study. And if you're feeling really anxious, you're feeling distressed, you're feeling depressed, as Deborah said earlier, you don't really always feel very sexual. So Ted talking, I wasn't even thinking about doing the business. Jessie talking about our sexuality diminished in the beginning and you're concerned, you're not interested in sex. And Margaret saying, I was too tired to be interested in sex. And we know that's a major factor also with people with cancer, that tiredness is a significant factor. And a study Jeanette and I did with over 2,000 women with breast cancer in Australia, who over 80% reported changes in sexuality. And we asked them, what are the factors that you think cause that? And tiredness was the biggest factor, was the number one factor. Now, these are quite significant in terms of psychological well-being as well as sexuality, as we've already heard. These are just some quotes talking about the distress that people experience because of the sexual changes. And Terry, who is in a gay relationship, talked about it distressed him greatly about his partner's distress about it, what he's lost sexually, and very hard to watch him go through it and very tiring. And many of the gay men that we interviewed talked about if they'd known that the treatment would have the impact on their sexuality that it did, they wouldn't have had the treatment. And that's as distressing for the partners as it is for the person with cancer. And many people across gender and across sexualities talking about great sadness. So Diana talking about feeling fragile, vulnerable and sad, and Bella talking about the sadness that you wouldn't be able to be intimate and procreate. And there's an intersection here with issues around fertility. And we just completed a large study where we've looked at fertility issues with both people with cancer and partners. But I'm not drawing that into this talk because of time issues. But the partner is also very significant there in terms of the impact of fertility on the relationship. Now, some people were resigned to these sexual changes. And you can see in two quotes here, Melanie talking about, well, we'd had good times, we'd had a good sex life, and, to be grateful for what you've had. And Bob talking about, I'm a bit disappointed because I don't dwell on it too much because it's part of life. So a sense of kind of move away from this feeling of sadness. But what I want to also talk about now is that this disembodiment is not necessarily a static condition. And in this broader theoretical framework that looks at disembodiment after illness, what we see is often a trajectory where people move from disembodiment to re-embodiment and renegotiation. And I think this links in with Deborah's talk earlier of the change in sexuality with the breast cancer study that she mentioned. And how this is described is that individuals can go through a process of narrative reconstruction, coping and adjustment, which can result in a realignment of body and self. And this is where healthcare practitioners, where clinicians are really important, because we can actually help people to facilitate this re-embodiment. Sexual changes after cancer is not necessarily a depressing topic. So looking at some ways that people do this. Now, these are accounts from people with cancer where some people adopted an aging discourse to accept sexual changes and say, this is part of life, this is something that happens to me, I'm getting older, sexuality changes anyway, so I'm actually kind of going with this. This is something that we actually found in primarily heterosexual participants. So Alf saying, I'm 58, I'm very pragmatic. George, it's not a major problem, I'm getting towards my 70s. Iris saying sex is not a big deal anymore. And Halla saying we're getting older, sex is not important. I think it's interesting, Halla's 41 and she's saying we're getting older. Now, I agree very much with the previous speakers saying that sexuality doesn't stop as people get older. And we know that many people, as they're older, continue to have very active sex lives. And many of our participants were in their 70s and 80s and were very distressed by sexual changes. But I think it's interesting that this particular ageing discourse was primarily adopted by heterosexual women and men. We didn't find any of the gay men adopted this discourse or any of the lesbian and bisexual women. There is a gender difference, and this is drawing from our carer study, where we asked people, is sex an important part of the relationship, an important part of life? And you can see here that from the partner's perspective, the men thought that sex was more important, either in terms of the relationship and a more important part of life. And I think it's interesting in terms of heterosexual relationships that many women partners are more accepting of the changes in sexual functioning than the male partners in the gay-male relationships. So I think that's where we do need to examine sexuality here. Other ways that people re-embody sexuality was partners were really important in the patient feeling positive about a changed body after cancer. So Heather saying, my husband tells me I'm beautiful. Vicky talking about her female partner loving the tattoos she's had on her body after her mastectomy, and Nina talking about still feeling very sexy. And in the breast cancer study we did of over 2,000 women, the partner response was the biggest factor in women feeling good about themselves after the breast cancer. Many men re-embody their sexuality through the use of sexual aids, through penile injections and implants. And here's a quote from Charlotte, who's a partner, saying, this is a godsend for him. And these aids, as I reported on Friday in my talk, are more likely to be used by the gay and bisexual men than they are by heterosexual men. And male partners are very important in this equation. Many couples re-embody sexuality through redefining sex as being not sexual intercourse in terms of particularly the heterosexual context, so rejecting the idea that sex is just coital sex, it's not just penetration, and partners are really important in that. Exploring other sexual practices, so non-coital sexual practices. So Nellie talking about they were like two puppies playing together, or engage in outer course, not intercourse. And this is across gender and across sexual identities. And many people said to us that actually they were having very good sex after cancer, and some people were having even better sex. You can see in Hank saying, you know, we're spending a lot of time in foreplay. So some people saying it's like being teenagers again. And Terry talking about you feel that love and intimacy that you felt at the beginning. So renegotiated sex can be very positive. Others talk about embracing intimacy after cancer, so cuddling and kissing rather than engaging in genital or other forms of sexual activity, and that can lead to people feeling much closer together, closer than before the cancer. As we've already heard, communication is a really key issue, and in our statistical analysis, alongside physical well-being, couple communication was the greatest predictor of sexual activity continuing after cancer. And partners are a really key factor in this because that's who you're communicating with. And these are some examples of good communication. And as we've already heard, and I can just flag this, that communicating with healthcare professionals actually facilitates the couple communication. So it's not just passing information to the person with cancer, it's also encouraging the couple to talk to each other about sex, because that's the most important thing. What we found, again, repeating other studies, is that in our carers study, only 20% of the carers had engaged in any discussion with a healthcare professional about sexuality. And of that 20%, only 37% were satisfied. And you can see across cancer types the disparity in whether this was likely to have taken place. Again, in our larger sexuality study of the partners, only 40% of the women and 28% of the men had engaged in any discussion with a healthcare professional. And there was a greater focus on the men with cancer and on sexual cancers. And just a couple of quotes saying, sexual dysfunction never mentioned, we were never told about it. And to me, that's really shocking that people can go through cancer treatment and not be told the impact of this treatment on their sexuality. And many of those discussions, if they did take place, were very heteronormative. So a quote here from a gay man talking about the healthcare professional not being comfortable with his lifestyle, and he kept talking about female partners, even though the healthcare professional knew he was a gay man. And one of the translational outcomes of our research has been to develop both self-help interventions and to actually evaluate those. And what we found is that they actually do increase communication about sex and normalise sexual changes. So to conclude, sexual embodiment can be impacted after cancer. We need to acknowledge the intersection of gender and sexual identities, but there's still many gaps, and the current study Jeanette and I are involved in is actually looking at this across sexualities. There's no research on transgender individuals and cancer survivorship. So anybody who's interested in talking to us about this, you can talk to us, or that's the email address of the study.